Good afternoon, everyone. My name is Xuanhao Chan, and I work for the International Pharmaceutical Federation, which is the global federation for 124 national associations of pharmacy associations. So we represent pharmacists and pharmaceutical scientists. In addition, I think this is an honor for me as well to be able to speak on behalf of the World Health Professions Alliance, which is a strategic alliance of the 5 main global professionals. So we represent the International Council of Nurses, the World Medical Association, FIP, representing the pharmacists, and the World Dental Federation. And in addition, we represent physical therapies as well, which is represented by the World Confederation of Physical Therapies. So, yeah, I just want to thank the PSM for inviting me to this conference. This is the first time that I'm here speaking on behalf of the organization to a US focus group. At the same time, I think I'm happy to share some international perspective. I'm based in Geneva. I work on behalf of FIP, managing the global advocacy and also some of the global health partnerships that we run in the Federation. And counterfeit medicines is one of the main key priorities for us. I just want to say that, okay, sorry, trying to find this. So there is a couple of issues and couple of areas that we work in when we talk about counterfeit medicines. And one of the key sort of initiative I would like to highlight in the next 10 minutes or so, which is the World Health Professions Alliance campaign on counterfeit medicines. To start off, before going into some of the details, I would just like to highlight that some of this work that we're doing was based initially on an internal review of 24 national initiatives combating counterfeit medicines. And on this slide, you see that, that of the 24 countries that we have reviewed, only 6 of them actually has a defined national structure. And this does not reflect national initiatives that are only being led by associations or health professionals, but rather national initiatives of multi-stakeholder approaches. And of these, 15 of them have limited structures and 3 of them have no interaction as well at all with health professionals. So some of the things that I want to reflect, sort of representing the professions, is that although we have heard a lot and we have read a lot as well, you know, about what professionals can be doing, patients can be doing, but the reality is that we find that the actual roles actually played by health professionals in these countries, or at least these 24 countries, are rather much unclear in the majority of these countries. Most of the documented initiatives that we see and we find mainly by government bodies and agencies, and that to some extent health professionals are often not educated and informed about their roles in national initiatives, and that they may not always be at the forefront of the battle against medicines counterfeiting. So sort of just to give you a bit of the flavor of in some of the ways that we have approached this issue, this is obviously a situation that WHPA or as FIP, we see this as a priority for the organization, for the profession, and also as a whole when all the discussions, you know, at the global level are going on, and that is something that we want to highlight. So in fact, that gives us sort of a strong mandate that we see that there is a clear need for strengthening of, you know, in terms of advocacy, in terms of capacity building, for appropriate investments in what we feel is one of the most important aspects that is not so often mentioned, which is the education and the capacity of health professionals to do 3 things at least. And that's what we feel, that it's on detection, reporting, and prevention of the infiltration of counterfeit medicines in the supply chain. And the way we do our business, in the sense that, the World Health Professionals, and for my job as well, is that we establish dialogue with key stakeholders, interprofessional bodies, interdisciplinary bodies, and we see that as an opportunity to create knowledge sharing of best practices, and also for the fact that, especially in this issue, for those of you who are close to this topic, there is a very strong need for the public health aspect to come out. And we feel that, and this is something that I guess I have offered to this audience, that to consider, you know, going through the health professional associations as a strong key approach for putting public health in the forefront when we are talking about counterfeit medicines. So Just going briefly through some of the things. One of the key main, let's say, we started this work in the last 2 years or so, in the sense of consolidating the activities and resources of the 5 international or global organizations. And one of the key highlights is that we started to see, obviously we have a lot of interface at the global level, but we started to see that there could be really some mileage to go down to the regional level. And what we have been doing in this campaign is to convene the first ever regional workshops that bring together national associations. So since the last 2 years, we have gone to Costa Rica for the Central America, and Abuja, Nigeria for West Africa, and Taipei for the Asia region. And in the event that I will just quickly show you, well, this is actually just taken in October. This was just organized in October 2010 in San Jose. Then this is just to show you some pictures that we have in Abuja and Taipei. I think the point to raise is that we find that this is quite innovative in a way from a policy and advocacy point of view, in that this is the first time that we are managing to bring together now, since these 3 regions, close to 80 national associations of 5 different professions. I mean, obviously for us, the capacity of the pharmacy society and the role of the pharmacist is one of the most priority that we go. And one of the things, maybe I can say a little bit more later in the afternoon, is that one of the outcomes of this work that we're doing is that we are putting together health professionals in the forefront, leading the discussions with stakeholders at the country level. And we find that, very interesting in terms of the dynamics. And also, one of the key outcomes of these workshops that we run is what we call a regional call to action, which is a consensus document that highlights and put together by national association leaders the key priorities that they face in the region, and also to even flag out some interventions or some key activities that they would commit to take up. So this is just one approach that we have been taking, and it's quite interesting for us until now. So for the campaign itself, it's as any regular campaign. So we have a toolkit, we have a website that you can find most of the materials that I just mentioned, and here are just like some examples of the toolkit that we have. We have defined several fact sheets, several key policy messages, but at the same time, I think because the work that we're doing is focusing very much at the interface between health professionals and patients, that we also have quite a bit of materials going into some of these practical tools for health professionals. Then this is just some postcards. This is quite interesting actually, because of the fact that obviously we work for 5 professions, but what is maybe less known for people who are working in this area of counterfeit medicines is the issue of counterfeit devices. And in this case, it's even slightly interesting because this is the issue of counterfeit dental products and counterfeit dentists, let's say, to some extent. So we find that I should maybe just say as well, a thread that runs through all the work that we do is the theme of multi-professional collaborative practice. And that's something that we find it, very interesting for policymakers, especially for ministers of health as well, because then we are not always just hammering on the issue of counterfeit medicines about supply issues, but the fact that there is this fundamental need for health professionals to work together in a multidisciplinary healthcare approach, not just at the policy level, but even at the healthcare team level. And for us, the issue is not about whether who is more knowledgeable about the issue of counterfeit, but rather the fact that for every encounter that a health professional will have with a patient, that's where there is this trust, where what you say matters, because what you say, the patient will follow to some extent. And for us, we see it as a more encompassing approach of multi-professional collaborative practice, and that's sort of a key aspect of the work that we're doing. Then, this is just something that's quite interesting, I think, where we also, at the different levels, work with specific countries, and we work with them in terms of capacity building for health professional associations. I think at this point, maybe, okay, there should be one more slide, but I want to highlight, as part of this introduction to some of the work that we're doing, is that at the regional level, we see where we can get the most mileage in terms of policy change, recognition of the role of health professionals, recognition of the fact that this is a public health issue. And that's where we find it most effective, at least at this stage. I mean, having worked in Geneva for the last 5-6 years, and also in the last 3 years with the World Health Organization, there is a lot of interesting debates, let's say, that may promote or deter development in this issue. And at the regional level, that's where we find that you can get most mileage. And there are sort of four, let's say, key strategies that we find that gain, a lot of leeway for some of these discussions. Is that we focus firstly on increasing capacity of health professionals. Secondly, we focus on fostering regional collaboration initiatives. Thirdly, to start the ball rolling in the sense of strengthening collaborative practice among healthcare professionals, how that improves health service delivery. And through that, of course, there's the issue of medicines, which is obviously an important component when we're talking about management of health. And lastly, we have had, I think, fortunately, I think, a very good relations working with regional entities, both at the WHO level and other regional initiatives. And I would say, I guess I sort of thought for now, this week is actually quite an important week in the sense of the fact that obviously there is a PSM meeting, and what is interesting for those of you who follow is that this week or today is the opening of the World Health Organization Intergovernmental Working Group, which would then hopefully come to a closure in terms of what is the current role of WHO in this issue of counterfeit medicines, what is the role of WHO in impact, for some of you who might be familiar with that. And if not, they are also coming to a consensus as to what are some of the options that we're looking at. So even if the World Health Organization is to take a certain position on some of these issues or some of these trends going on, what are some possible options that we have at the global level that it's worth member states to come to a consensus on? And in addition, I think just to highlight again the fact that has been mentioned earlier, that today as well, the meeting opened in Moscow, which launched the Medicrime Convention, although primarily I would say is definitely targeting sort of, I think the first round of the 47 member states of the Council of Europe. But at the same time, I think what is interesting is that it is also open for ratification by non-Council of Europe member states. And that the focus being the fact that this is the first actually transnational, let's say, transnational treaty looking at obligations of of parties to the convention, looking at also a specific focus on strengthening of legislative instruments in the combat or, let's say, management control of falsified medicines. And then there is all of that, which I think is quite interesting, that would perhaps inform some of the developments in the US. And at the same time, as I mentioned earlier as well, I think there's a lot of good work going on in the US, and also because of the fact that the US is such a major stakeholder, even with the discussions on the internet, I think you set sort of really the stage for some of the things that could really happen in the rest of the world. I think the question is, or the approach is definitely to see how, at least for my perspective, we would want to play an active role in facilitating some of these discussions between countries, and then trying to also be the messenger, let's say, for the public health aspect of counterfeit medicines, which I think it's really important. Sort of finally, I think I just want to sort of give a kind of snapshot to some of the perspective, because I was just talking to a pharmacist in Nigeria, and one of the things that he said is that while we talk about very high level stuff, when you ask someone on the street, or when I just ask him, so how would you actually translate all this high level policy and high level stuff to the patients that you're seeing every day about medicines, and he say to me, it's quite interesting because it's actually quite straightforward. He say, what you tell the patients is, in the world, there are only two kinds of medicines: quick-acting and long-lasting. And when you're in pain, you just have to decide whether you want to feel better now or later. So for me, that was quite interesting because, in the end, it boils down to just simple messages like that. But at the same time, he said, because of the fact that he is a health professional, there's a lot of non-financial incentives for him to do his job and for us to ensure that more people are doing their job or doing the right things, which is to say that there is also a third category of medicines, and that's counterfeit medicines, and that is not funny at all. And the risk is that, at best, it will never make you better, not now, not later, or not ever. And at worst, it will kill you. So I think for me, that was a very nice take-home message as to how pharmacists are actually doing the work that I think we want to make sure that they have the capacity to do that as well. So with that, thanks again for having me.
Thank you.